Hello and welcome, future nurses. Today, we're diving into a crucial skill breakdown that's absolutely essential for both your exams and your future clinical practice: nasogastric and nasointestinal tube insertion. Okay, let's get right into it. We're going to break this down into 5 clear, manageable phases, just like you would in a real clinical setting. We'll start with the basics, then move into prep, the insertion itself, confirming placement, and finally, aftercare and troubleshooting. So first up, let's lay a really solid foundation. We need to get a handle on what these tubes are, why we even use them, and, super important, who's actually responsible for this skill. At its very core, this is what we're talking about: a flexible tube that gives us access to the GI tract for some really specific reasons. It's a fundamental tool that you're going to get very, very familiar with in your career. And this is where you can really see the key difference. Is our target the stomach, or do we need to bypass it? With an NG tube, we're going right into the stomach, maybe to decompress it, maybe for feeding. But with an NI tube, we're intentionally going past the stomach, right into the intestines. This is a game changer when, say, the stomach isn't working properly. Okay, this is huge for you as a nursing student, knowing your scope of practice. An RN, yes. A qualified PN, you bet, with the right training. But you absolutely cannot delegate this to assistive personnel. No way. This is a skilled procedure, and that responsibility stays with licensed nurses, period. All right, let's move on to prep. Because a successful insertion, it starts way before you even tear open that tube package. Seriously, think of this as your pre-flight checklist. Getting this right makes everything else go so much smoother. So, before you grab a single piece of equipment, these 3 checks are completely non-negotiable. First, you're diving into that chart. Any history of facial surgery, any contraindications, you need to know. Then, you're using 2 identifiers to make absolutely sure you have the right patient. And finally, you ask them directly about allergies, even if it's in the chart. Safety, safety, safety. Okay, let's talk about getting your gear ready. You've got your gloves, your scope, the tube itself, some lube. You see the whole list here. Having all of this laid out and within arm's reach before you start is just pro-level stuff. It means no scrambling, no interruptions. It keeps you focused on what really matters: your patient. And here we go, the main event. This is the critical path of the insertion itself. This is where your hands-on skill, your ability to communicate calmly, and your patient's cooperation all come together in one moment. First things first, patient positioning. Getting them into a high Fowler's position is your first move. Why? Because you're using gravity to your advantage. It just helps that tube travel down the right path, and honestly, it's way more comfortable for your patient. Okay, listen up, because this is so important. Getting the measurement right isn't just a suggestion, it's critical. If you're too short, it won't reach the stomach. Too long, and it could coil up. Getting this wrong can lead to some really serious complications. You have to nail this step. So, how do we get it right? We use what's called the NEX method. The N to E is the first part. You're simply measuring from the tip of your patient's nose right to their earlobe. Easy enough, right? And to finish it off, we do the E to X. From that spot on the earlobe, you measure straight down to the xiphoid process. You know, that little bony bit at the very bottom of the sternum. Put those 2 measurements together, and that's your total length for an NG tube. Now, this is a classic exam question, so pay attention. For an NG tube, you stop at your NEX measurement. But for an NI tube, you need to go further, right? So you take that NEX measurement, and then you add an extra 8 to 10 inches. That additional length is what gets the tube past the stomach and into the intestines, where it needs to be. All right, as you start to advance the tube, remember these key actions. You've got to lubricate the tip. That's a given. As you insert, a little gentle rotation can help it navigate the path. Then, the big one, have the patient tuck their chin to their chest. That helps close off the airway. And, if they can, have them take small sips of water. Every swallow helps guide that tube right down the esophagus. Okay, so you've advanced the tube to the mark you made. You might feel like you're done, but hold on, you are not done. We are now at arguably the most crucial 100% safety critical step of the entire procedure. And that's answering this one question. Is the tube in the right place? You can never, ever assume. You don't guess. Using a tube that's in the lungs is a catastrophic error. So you absolutely must verify placement before you do anything else. So, how do we verify? Well, your facility policy will guide you, but typically it involves two methods. First, you can try to aspirate some stomach contents and check the pH. But the undisputed gold standard, the one that gives you a definitive answer, is a radiograph, an X-ray. That is the only way to be 100% sure. Now this number right here, this is what you're looking for. A pH of 5.5 or less. That low number screams acidic environment, which is exactly what you'd expect to find in the stomach. If you get a reading that's higher than that, say a 7, you have to hit the brakes. That could mean it's in the lungs or the intestine, and you need that X-ray confirmation before you move a muscle. All right, so you've gotten confirmation, the tube is in the right spot. Awesome. But we're not quite done. Let's talk about aftercare and, just as important, what to do if things go sideways. Being ready for the what-ifs is what separates a good nurse from a great one. These last steps are just as critical as the insertion. You've got to secure that tube properly so it doesn't move. You need to provide good oral care. Trust me, your patient will thank you. Your documentation has to be spot on, telling the whole story. And you always do one last safety check before you walk out of that room. Okay, everyone, eyes here. These are your red flags, your stop immediately signs. If your patient starts turning blue, if they can't speak or make a sound, if they're coughing uncontrollably, you stop right then and there. This means the tube is likely in the airway, and that is an emergency. You pull back and you focus on their breathing. And this is the final piece of the puzzle. Great documentation. Why? Because you're part of a team. Your note tells the next person everything they need to know, which nostril you used, the tube size, how placement was confirmed, and how the patient handled it. It's what ensures that care is safe and continuous long after your shift is over. Hey, if you're working on mastering skills just like this for your NCLEX, you've got to check out our revision books. The link is right down in the description below. They're super summarized to give you exactly what you need. And if this explainer helped you out today, do me a favor, hit that like button, share it with a classmate, and subscribe for more nursing skills breakdowns. Oh, and drop a comment below. Let us know what skill you want us to tackle next.